So combating HIV/AIDS and hepatitis C is something that one agency can't do by itself. It needs community collaboration. So the Dallas VA and
Prism Health North Texas.
We're excited that we met each other way back in 2011.
That's right.
And because of our great collaboration, we've been able to maximize our resources so that we've been able to offer more prevention of HIV/AIDS and hepatitis C services. We've been able to link people veterans into care who are infected, actually provide HIV, hepatitis C care, and then also give an opportunity for veterans to participate in research to expand the clinical knowledge about HIV. And regarding the prevention pillar that we're working on, can you please tell us more about rapid HIV hepatitis C testing?
Sure. Well, we should be very thankful that we have the capability to do rapid testing. You know, it's enabling us to get out into the communities, so we don't have to be near a laboratory. You don't have to run blood specimens. You know, you can do these tests virtually anywhere. And so the best thing that we have with rapid testing is we can get out and reach people, find people that need to be tested that just simply don't have access otherwise to general medical services.
How long does it generally take to get those test results?
Well, you know, amazing thing, we have some technologies now that can give results in about a minute. So really fast results and accurate results. But I think it is important to have the partnership because you know, we do need to reach people that are traditionally not being reached, either in the veteran services, through the healthcare system, or in the general healthcare system in the country.
The way the VA is structured, a veteran needs to have an active medical record, but if the person's homeless, doesn't have ID, is unable to have that active medical records. But you all can step in where we could not. So again, thank you so much for your help.
You know, we're finding more and more people are just simply lost to care, and those are often those that are homeless. And so it's really that collaboration that we have to have in order to reach people that really need to be reached.
For 34 years, Austin Street Center has been providing basic needs, emergency shelter, showers, clothing, meals, to over 400 people that come to us for help every evening. We also will work with the VA to transport people to and from the Veterans Hospital so that they have ease of access where it comes to their health care needs. The VA comes here on site and provides health needs assessments, both for their physical health as well as their mental health.
Another thing that's really good about the partnership is there's options for the patients and clients. And one of the things we learned that, you know, some facilities are good for some and then others are going to be good for other people. And so the best thing that we can do through the partnership is offer options and opportunities to not only get the testing done, but also get people into available and effective services.
So not only are you or Dallas VA treating the HIV or the hepatitis C, we're also taking into consideration housing factors, we're taking into consideration mental health factors, substance abuse factors.
I got injured several years ago and I wasn't able to work and I had financial problems, so that led me to being homeless. Caseworkers started working with me and helping me and directing me to different agencies that could help me and, you know, get my life back on track. The VA has been very helpful in this transition that I'm going through, and it's working for me and it's getting better, and I see a lot of benefits in working with VA, and the caseworkers and the counselors are very helpful.
If you don't have integrated services, you just cannot be effective in your approach. And so, you know, when we're dealing with individuals that have substance misuse or mental illness, other medical conditions and or hepatitis and HIV, you really got to look at the whole person. And if you're not integrated in your approach, then you're really going to be missing those opportunities.
We've had more than 2,000 veterans that come to our homeless stand down, and more than 400 got tested. Since 2014, when technology for hepatitis C rapid testing came, we've had another 100 veterans tested. And because we want to not only test but get into care, we have a designated clinician who guides the veteran into either care with us at the Dallas VA or care with y'all for HIV or hepatitis C.
Well, we had one patient who he actually served, I believe, in Vietnam. He's an older gentleman, and he actually came to us when he was newly diagnosed with HIV, and he was homeless at the time, but he did really well. He never missed a visit. He stayed undetectable. He actually was on the streets the entire time of that study and very resistant to actually coming to any kind of homeless shelter or receiving any kind of services that might help him find a house or a home. And then he got really sick and he wound up having to have surgery. So we wound up getting him in touch with a behavioral health case manager who helped get him into a respite care. And from that, he really enjoyed having a home, and it's been quite the transformation in him.
We are one of the few community-based organizations that does run clinical trial research without an academic setting. So it's really, I think, a testament to the partnership that we have that enables us to do that.
We hope the future of HIV care, what happens with HIV specifically, is that the majority of infections are from people who do not yet know they have HIV. So outreach, finding people in the community, testing them, and if they test positive, rapidly involving them in care or linking them in care, it's something that is incredibly important to controlling the HIV epidemic.
And if you could talk about how people in living with HIV/AIDS or at risk of getting HIV/AIDS, that relationship with suicide.
Well, you know, unfortunately, HIV still carries a high level of stigma associated with it. And one of the things we've learned over and over, and even today, even with the great treatment that we have, there's still misperceptions and myths around HIV and AIDS. And it can be a very isolating space, and oftentimes what we're seeing is a lot of mental health crisis associated either with new diagnosis or just really the ongoing challenge that's associated with keeping up with care effectively. And so, you know, we've learned more and more this integrated approach is absolutely critical because without it, we're gonna lose people.
I would encourage anyone watching this process to find and seek in their own field of interest who is available in the community who could further our mission and with whom we could partner.
There is a really nice partnership because we both see that value of bringing these research opportunities really to a community that would typically have access, but it really does take, you know, the comprehensive approach, which we both get.
Takes a village.
Takes a village, absolutely.
Well, thank you so much for a wonderful collaboration.
Thank you.
Looking forward to many years for
Likewise.
the working. Thank you.